And now I'd like to introduce Pat Sevean a little more formally. Pat is a professor of nursing at Lakehead University. She became a director on the Kidney Cancer Board in April this year. She brings a general surgery and oncology background as a nurse representative for Kidney Cancer Canada to the Medical Advisory Board. In the fall of 2014, both Pat and her husband Lynn had radical nephrectomies for renal cell carcinoma, and they're being followed by the cancer program here in Thunder Bay.
Tonight I'd like to tell you a little bit about my story. Deb already said a little bit. But, you know, getting a cancer diagnosis is really very, very difficult and very, very shocking. And I don't care if you have worked in the cancer field. No one knows what it's like to get cancer but people who get cancer. And then you know what it's like. Well, in 2014, both my husband and I got kidney cancer, or discovered that we had kidney cancer. And 2014 was an interesting year. It was a tale of 2 weddings and 2 nephrectomies. And life is like that. And my daughter got married in January of 2014, my oldest daughter, Kelly. And that was the Jamaica Me Crazy wedding. And we were in Jamaica and having fun on the beach. And we had no idea that cancer cells were growing in our body, right? And we were yet to find that out. Now, we have a very wonderful family physician who we go for annual checkups, and we were lucky we got discovered very early in our cancer. I had to have an ultrasound because they thought I had a kidney stone, which I did, and there was a little tumor sitting right beside the kidney stone. My husband had some blood in his urine. You couldn't even see the blood. It was microscopic. But he had an ultrasound, and he had a kidney tumor. Now, you might say to yourself, how does that happen that 2 people married to one another for almost 45 years, get kidney cancer together? But it's kind of astronomical, but on the other hand, it's the way life works out. Now, we were going to our daughter's wedding on October 4th, and that was the wedding that was at the Elmhurst Inn, and it was the Star Trek wedding. And we were so looking forward to the wedding, but prior to that, we had to have our surgeries booked right after the wedding, because we knew that we had these tumors and we knew that we had to have nephrectomies, so we had to get those surgeries organized. And while we were at our daughter's wedding, the office called us from here and said, your nephrectomies are booked. So here I am. There's Pat with 2 kidneys, and then now Pat has 1 kidney, but you can live on 1 kidney. And there's me. We took selfies to a new level, my husband and I. I don't know if we had permission to do it, but we took pictures of ourselves in the hospital. And there's my oldest daughter there that I mentioned, it, Kelly, visiting me. And it was quite the experience. And actually, it was November 20th, 2014. Today is November 19th. So 1 year ago. I'm here, I'm well, I'm on follow-up, so this is good, right? A lot of fear at first, a lot of confusion, a lot of lack of knowledge. You have to find things out quickly, but you can survive it by putting your one foot in front of the other, right? 1 day at a time. So then here's Lynn. Well, he actually had his surgery before me. His tumor was a little bigger, and we thought we'd get him. And this is all here at Thunder Bay Regional, okay? And this was on October 23rd. And here he is, you know, getting ready for surgery. And here he is walking down the hall after surgery with his favorite nurse. So let me tell you about Kidney Cancer Canada and how I got there. When I was looking for information, I couldn't find much. You know, and, I thought there must be people out there with kidney cancer. I didn't know anybody had kidney cancer. It seemed very strange to me that I wouldn't know that, but how would you, you know? And so I looked on the internet and the web, and that's what everybody does, and I found Kidney Cancer Canada. And it was founded by these 2 wonderful people, Tony and Deb, in 2006, and they met in Princess Margaret in the lobby, and they met as patients, and they started this Canadian Charitable Support and Advocacy Organization, and it's grown to be well over 2,000 members across the country. And There is a board of directors behind the scenes. There's a board of directors. 9 of the 12 members are either kidney cancer patients or providers, caregivers. And then we have a CEO and we have some staff, but they all work virtually. And it's a highly respected organization now. It's done very well over the past almost decade. It has a medical advisory board, and of course the chair of our medical advisory board is Dr. Kapoor. And it's also very well connected with the Kidney Cancer Research Network of Canada and also the Kidney Cancer Canada Nurses Network. The vision is to improve the lives of Canadians affected by kidney cancer by providing support and information, by advocating with governments for pharmaceutical drugs and strong advocacy to make sure that patients have access to some of the new and emerging treatments. Patient support and education, which is what we're doing tonight. We do sessions at least 4 a year across the country. There is also a patient conference every year annually, and this year it's in Toronto on March the 5th. We also do a lot of awareness raising because people don't know about kidney cancer and they don't know about, the signs and symptoms of kidney cancer. And then we do all of the things with the Medical Advisory Board and the Research Network. This is the website, which some of you may have been familiar with because you went on it. And it's a very active website. It has a lot to offer. You can go in and read patient stories. So this is sort of the new way of getting information in this world, is that you can go on the web and find it. And here's our partners. We partner with a lot of other cancer agencies, plus the Canadian Cancer Society. We work with them closely as well. And here we are this evening. We have Dr. Kapoor here to tell us about some really new treatments that are changing the face of kidney cancer in a very positive way. And we will have the expert panel, which we will introduce later to you when we start the session with the question and answers.